We're really excited that you're joining us today for what we hope is going to be a really interesting conversation. My name is Sara Toomey. I am a hospitalist here at Children's, and I am the Chief Safety and Quality Officer at the hospital. And I'm really excited to be able to talk with you today about virtual visits, about a little bit about what we've learned over the pandemics as we've really seen such an increase in use of virtual visits, and to hear firsthand from some of our specialists and also our primary care docs around what their experience has been, and to answer questions that you have. So to start us off, I'm going to just ask for people to go around and introduce themselves. Michelle, why don't we start with you?
Sure, thanks. Hi, my name is Michelle Locke. I'm a primary care pediatrician in Stoneham, Massachusetts at Commonwealth Pediatrics, and thanks for having me here with you today.
Sara, why don't you go next?
Hi, I'm Sara Ferranti, and I'm a pediatric cardiologist. My interest is in preventive cardiology and general cardiology, and I'm here as the division chief for ambulatory cardiology. So running the clinics in Boston and around the satellites.
Thank you. And Carlos?
Thanks, Sara. Hi, I'm Carlos Estrada. I'm a urologist at Children's Hospital and the urologist-in-chief of the department here. So great to be here today.
It really is. It's really wonderful to have you guys. So just for those of you who might not have as much of a sense of what's going on with virtual visits at Children's, I thought I'd just start by saying, we have had an active virtual visit program for quite a while, but needless to say, as was the case with many different hospitals, when the pandemic hit, it really accelerated the work that we were doing. And it's been very exciting for us to be able to provide access to our patients and families throughout the pandemic. And in addition to that, has given us tons of information about how best to use virtual visits in the context of providing highest quality care possible. To give you a sense of just how important they've been at times, we were doing, many of the subspecialties were doing half or more of their visits as virtual visits. We now do, just for awareness, somewhere around 20 to 30% on average, we're doing virtual. So most of our visits have changed over to being in person. However, I think the experience of the pandemic has really just accentuated for us the value of virtual visits and how they can enhance access, that our patients and families really appreciate the opportunities, and that they've really been an important component of the care that we provide. So with that, I'm going to kick us off with some of the questions that we have and go around and ask people. But I think I'm going to start with Carlos and Sara and just ask, how do we at Boston Children's determine what should be a virtual visit versus an in-person visit?
Yeah, Sara, that's a great question. It's sort of the fundamental one, right? And so, we actually got off to a bit of a head start prior to the pandemic because we had been doing the majority of our post-operative visits virtually. And so we had this experience where we felt comfortable with a physical examination, a urological examination virtually. And so we had a couple years head start on this. And so going into the pandemic, where we really had to scale up, we felt comfortable and confident in the patients that we could effectively see. So as far as a fairly simple way that we think about it is that if we need to do a physical exam in person for whatever reason, that patient certainly needs to be seen in person. If it's a visit, like many of our visits in urology are, where we are reviewing a radiologic study that was done, and then discussing the study, sharing the screen, showing what we see, discussing treatment management, follow-up, et cetera, we feel very comfortable that that can be done very effectively virtually. In fact, as effectively as we do it in person.
Sara, how do you all think about it?
No, that's interesting. I mean, I would say our cardiac surgical colleagues had also been using virtual visits for post-op for a number of years, and that was super successful. On the medical side, we had just started doing some nutrition visits, which are actually super well suited for a virtual setting. You can have families like show the foods that they have in their kitchen, and I think you're much more likely to get somebody to spend a half an hour on a nutrition topic if they don't have to drive anywhere. But we hadn't really, gone into the general cardiology topics until the pandemic. And I have to say, once we started with that, it's been a real great opportunity. We've looked at our algorithms for scheduling and figured out which visits make a lot of sense to do virtually or offer a virtual option, and which make more sense to be in person. Clearly, we've revised that a couple of times. So, somebody with a murmur, it's hard to evaluate them virtually, but we certainly love to talk about things like palpitations or dizziness. These are great topics to get a sense of by doing a detailed history. And I find that I can really get more connection with a family if I have a half an hour to really just sit with them in a Zoom room and talk through all of these nuances, as opposed to coming in and out of an exam room, especially given how much anxiety there is for kids. So we use some algorithms for scheduling. We always offer both options, but there are some symptoms or chief complaints where we say, if you'd like to do a virtual visit, we have that. And it's definitely helped with patient access, meaning like getting families in sooner because we have that option.
Carlos, do you have, I think that's really interesting, Sarah, that you guys have created some algorithms to help you decide what's optimal. How do you think about it, Carlos, for you guys in terms of what visits are good for in-person versus virtual?
Yeah, and thanks, Sarah. And yeah, we've done the same thing as Sarah has in cardiology, in that certain diagnoses are just hard stops, should be in person. Things like undescended testis, which you can't really ask a family to help you do that examination. That's one that we need to do and own. And so that's a patient that needs to come in. Hypospadias, for example, is something that we can see virtually, but certainly not like we can in person. So bottom line, if it requires a detailed physical examination, genital examination, those in our algorithms generally require an in-person visit. We also like to see new patients in general via in-person to get a good physical examination. And so those things are worked into our scheduling algorithms for sure.
Michelle, how have virtual visits been utilized from your perspective in your practice, and what have your patients thinking about them?
For the most part, I think they've been really well received. I think that it's certainly helped with access. My patients have been pleasantly surprised at how they've been able to be seen quickly by Boston Children's Hospital. Many of them were expecting to have months and months of waiting, particularly when a lot of what they've heard in the media is that patients have been waiting a long time to see specialists. So they've been very happy with the care that they've received. We get referral notes back very quickly, and we see that they've been booked in a very, very timely fashion. And often those first visits have been virtual with a quick follow-up appointment. Maybe that second appointment has been in person, maybe it hasn't, depending on what happened during that first appointment and depending on the specialty service that they went to. So families overall have been very happy because it's been a shorter time from being seen in the pediatrician's office to being seen by their specialist. They've been happy because they've gotten good communication between their pediatrician and their specialty service. So they know that what's happened in the pediatrician's office has been well communicated to the specialty team, and that's what's allowed them to have a good quality virtual visit as well. So I think they've been overall very pleased with that because everybody's happier knowing that everybody's working together as a team. So that has been overall really good. And they've also liked that because I work out in the suburbs, even though I'm not very far from Boston, it doesn't mean that it's very convenient always for my families, especially those with multiple children, pack everybody up and drive into even the city or a satellite location. So it's been very nice for them to sit at home and have that visit and not have the additional burden of travel and feel like they got a quality visit without having that additional burden on them as a family. So overall, I think they've been very well received, and patients have been very happy that they've gotten what they needed without those additional burdens of time and travel and without sacrificing good communication.
Yeah, that's really excellent, Michelle. I have to say, so from I sit on our family advisory council, and hearing some of their stories and reflecting, I think it's certainly everything that you said they would wholeheartedly agree with. Say some of the other interesting ones that have surprised me, well, maybe not surprised me, but that I've been really happy to hear are that families think actually that sometimes the subspecialist can actually understand better who that patient is by seeing them in their home environment. That they're able to interact more often. The child for whom they're coming in, you really want to see them walk, and they don't want to leave their parent's side. But when you go and you see them running across the room in the living room, you can kind of be clear that, well, that's looking pretty good. So there are ways for which and actually even for some of our really complex patients, for them their home environment really does maximize kind of their ability to communicate and to sort of be themselves, along with others. So somebody had mentioned mental health in the comments, and that's another one for where people being in their home environment and being able to interact has been great. And then our substance abuse program is another one where they've seen the adolescents for whom they're in that program, they've had fewer no-shows or missed care opportunities, and have and seem to be more engaged. So it's great to hear that you're hearing that from your families too, that there's real benefits. And addressing a question that came up, and I don't know if you all know, they were commenting on out of state for college students. So people for whom their insurance obviously is here, et cetera, but they are out of state. I know during the pandemic, if it was an established patient, we were able to do virtual visits out of state, but I'm not, to be frank, I'm not sure if that's changed. Sarah, do you know whether or not we're still able to do that for established patients?
Yeah, the last time I checked in on this, it was, yep, established patients, you can follow them up. And it's actually a really great way to stay connected with that age group that tends to drop out of care and show up again right after exams, with things to sort through. So my sense was actually that you could do follow-up, but not new patients. But it sounds like we're getting a chat that maybe we don't have all the answers on that.
Yeah, so we can try to get that and feed that back in. And I do think there's differences between new and follow-up, but I mean, Barbara is suggesting that actually at this point that there aren't any ability to do that anymore. So we'll follow up on that. I agree with Sarah. It is a really nice opportunity. I also know that there are that many of our faculty are looking around, especially when they have patients that are in certain states. We are looking at ways for which we can get credentialed in those states to provide virtual visits care. So hopefully that might be something that we'd be able to do in the future too. In terms of thinking about what we've learned. So Michelle, you certainly tacked on to sort of access and the importance of that. Are there other ways for which you think that we've been able to kind of like the examples I gave, but other examples, what else have we been able to do by utilizing virtual visits that we might not be able to do in the in-person setting? Sarah, I don't know if you want to talk a little bit more about sort of the nutrition or from the preventive cardiology lens, some of the benefits that you've had, because I do think that there have been some that really aren't, there really are value add, if you want to think about it that way. And Carlos, I don't know what you're thinking too in that regard.
I mean, I can just say there are a couple situations where there's value add, so that I can talk about right off the bat. I mean, the first is preventive cardiology. So talking about physical activity and diet, no one really wants to talk about that. It's really gotten challenging over the pandemic for people to stay active and move around, and kids, this is really tough for them. So making it as easy as possible, getting rid of any speed bumps to talking about this type of thing is really helpful. People can we can review lab results, we can talk about blood pressures that they can get now they're, a lot of people are happy to get them in their own house because it tends to run in the family, and parents have a device to measure their blood pressure. We can do a lot of like quick check-ins, which I find are more effective for lifestyle change. The other place where I think virtual visits are actually a value add is around patients who have a lot of different sort of hard to put your finger on symptoms, palpitations, dizziness, chest pain that's non-exertional, where, the easiest, quickest thing is to order a bunch of tests and then get the test results and see the patient, but it's not the most effective thing for the family. And so these visits can really be useful when you have a chance to dig into some of those symptoms first. Not to say you're not going to see them in person, because you do want to see them in person to do a full exam, but then you'll be able to say, okay, I think what you need is this test. We're going to order that. We're going to get those results, and I'll see you and follow up in person. So kind of flip, like a little flip classroom kind of a setup where you do the physical exam and the full physical visit after you've done it. So kind of like some triage, which I think is reassuring for families as well, because you sort of talk through the possibilities, you do a bit of testing, you see them in person, and you can, really make sure that you do the testing that needs to be done and not extra testing. So I think those are some scenarios where I'm really happy with using virtual visits.
Yeah, I will add to that, I treat many patients and families, kids with spina bifida in our spina bifida center at Boston Children's Hospital. And the value to them by being able to stay home and do a virtual visit, instead of going through all the different things that it takes for those families to get to Children's Hospital, special transport in some cases, many children who are wheelchair dependent have, significant complexities, intellectual disabilities, et cetera, families with multiple children. I mean, all the burdens that these families have to manage are, made easier by virtual visits. And so instead of all of that to get to Children's, we can connect virtually. So that has made a huge difference for those patients and families. And I think it does help to see those patients in their environments. Our neuropsychologist in the center can attest to this, and to Sara Toomey's earlier point about seeing patients in their environment and how they respond. And they, are different at Children's Hospital when they've been waiting 8 hours all day to see a bunch of providers. And so it's nice to see them in their environment and see how they really are. And so that's a huge value. The second thing that we've experienced and we've really learned is that decoupling diagnostic studies from an office visit leads to significant efficiencies and convenience for patients and families. So back in the bad old days, we used to always schedule a test for convenience and then same day see the urologist. Well, that limited access, that limited the dates with which we could work. So we only have, Dr. X is available when the ultrasound is available, and that's it. And so now we can set up an ultrasound at their convenience, before school, after school, whenever it works for them, and then do a virtual visit sometime soon thereafter to follow with much more flexibility. So I think that's significant value add as well.
Michelle, anything that you'd add from your perspective?
I just think it's really nice when patients have the ability to be surrounded by their things and show you who they really are. I know that point has been made several times already, but when you give people the time and the space to be themselves, you get a better picture of who they really are. And I know that, I think you really can't discount what that does to no-show rates. I know that that is something that people tend to think about as logistics, but and they tend to think about that around access, but you can't help somebody that doesn't come to your visit, whether that's in person or virtual. And anything that increases the likelihood that you have contact with that patient, I think about that, especially around follow-up care. You make it easier for patients to come and talk with you about how they're actually doing. You increase the likelihood that that patient is going to get better care. They're going to have better, I hate using the word compliance, and I'm trying to think of a better word right now, but if you make it easier for patients to follow through with you, you increase their quality of life. And that's what virtual visits do for people. I don't think that you can ever emphasize enough how much better that makes patient care overall. That's experience, but it's also healthcare and quality, and that just can't be emphasized.
That's great. Yeah, Sarah?
I did want to say, you know, I'm just reflecting about all of the pluses that we've described here in our different areas. And I've learned a lot actually from hearing from Michelle and Carlos. There also are some downsides. I wouldn't want people to think that like we should only be seeing patients virtually, or that there haven't been a few hiccups, because certainly in the very beginning, I mean, the technology was a challenge. We had to teach 90 different cardiologists how to use, Zoom, or it was a different platform before. No one was in the right place to make their computers work. I'm sure everyone's had embarrassing moments where somebody passed by in the background. So it hasn't all been perfect. And I hope now, with a couple of years under our belt, we're much better at figuring out who benefits, where it doesn't make sense. But we're always trying to make things a little bit better. So I would always want to hear from people, from you all, if you feel like things are not going the way that you had expected, or from families. And we have heard sometimes about that. And I appreciate that.
Yeah, the comments, they change from I had to wait for a long time and it's a pain to get into children's, to the technology had some hiccups or whatever else. So, there are some things along those lines. And, I agree with you, Sarah. There's clearly, by no means would I either try to suggest that, virtual visits are the answer to every concern. But I think what actually all of you are suggesting is that having them as a complement, as another option, can really enhance the care that we're providing, which from our perspective really is sort of a longitudinal relationship, right? So, and in that context, virtual visits, I think, can be really valuable, and do allow, Michelle, to your point, our ability to have more frequent touch points, and for people to see even, the value of those interactions. I mean, I've heard patients and families say, for instance, we spent all this time coming in for a follow-up visit, and basically they spent 5 minutes asking me how I've been feeling, and they barely even, examined me. And then I spent another hour getting home, whereas if it's just on the screen and you're docking in and you're able to do something quickly, I think it just changes the way people perceive the value of those interactions. What's been most surprising to all of you in regards to virtual visits?
I've really loved how it's enhanced my interaction with my colleagues at Boston Children's Hospital. It's helped me learn. It's made me a better pediatrician, because a lot of the times my colleagues are relying on my notes and my referrals to enhance the quality of their virtual visit. They need to make sure that, they may be relying on some of my physical exam components because they might not be laying hands on this patient. So I feel like I have to, it's a lot of quality in, quality out. So I need to be providing that quality to my colleagues and being really explicit about my reasons for referral. I actually like that interaction. I feel like their virtual visit may be more enhanced with better information from me. So it actually strengthens that interaction between me and my colleagues. And I enjoy that as a pediatrician. So I think that is always a positive, and I enjoy that part of my job a great deal.
That's excellent.
I'd say that the most surprising part probably is, our ability to really connect with patients and families virtually. We have had some cases, in fact, many cases in the past 2 years, where we see a patient appropriately and we can do an exam. We feel comfortable in the exam, so comfortable that we can schedule an operation and then meet the patient and the family for the first time in the preoperative area, and still have that same connection, that same relationship that I think we would have had we seen them initially in person. And that's a very select group. We don't do that a lot, but it's just to say that we can connect with people over virtual connection. And I think I might have predicted that it might not be the same. But it turns out, I think it's pretty good.
What about for you, Sarah? What's been most surprising?
I guess it's the same. It's that connection that you can have surprisingly over a video that if you spend 25 minutes with somebody really sitting there and talking and relating to them on a video screen, it's surprisingly kind of close connection, like kind of intimate, that you're really hearing from this family for quite a long time. If you imagine what you do in an office, you're in, you're out, somebody's knocking on the door, it's loud, they've had vitals, like it's actually much more talking sometimes than you might get in other situations. So yeah, same surprise. And when I meet them in person, it's like, oh, old friends, like even though we've got the masks on, we're like, oh, it's so great, because you have
Well, that's
that.
the other thing. You don't have the masks on, right, with virtual visits, which is nice. You actually get to see people's faces and smiles, and that I think helps too.
Yeah, same thing. But
Yeah. I know I alluded to the fact that we've been closely monitoring our patient experience data, and we'll say that it's really equal in regards to the experience across the house in regards to virtual visits versus in person. Sarah and Carlos, are there other ways that you all monitor sort of the efficacy and or the quality of the virtual visits in any way versus sort of in person? How do you guys think about that?
I could just say that I'm working with a fellow now on a project around this, and we're going to go and like do some chart audits to see, for specific complaints like chest pain or dizziness, and then also for follow-up of complex disease where you're partnering it with testing in advance, which we love because you get a final result. You can actually go look at it with the person who read the echo and say, what do you think? And then come back and to the family with a full opinion that you can then, share the screen and show them the images. But so we're going to do some assessment of that. And I think that will help us get a better sense of how we can even better use this type of visits. So.
Yeah, and yeah, it's super important, Sarah. And we have an ongoing study where it's a QI study where we compare certain diagnoses and the physical exam findings between virtual visit and the subsequent in-person visit, and see if they match up, and to see if we're doing as good of a job virtually as we think we are. And results are still preliminary, and I can't really report on them just yet, but I think we feel comfortable that things are going very well. So, but that's an ongoing study. We've also published pre-pandemic on the post-op experience, both provider and patient and family experience, and both were, line up with the current data that you're reporting, Sarah, and then just excellent satisfaction scores for both providers and for patients. And we also just put together a study. We had a hybrid for a period of time when the pandemic was really at its peak, where for patients that were coming in person, because we had to examine them in person for whatever reason, we would still conduct part of the study virtually. And so the so-called hybrid. And so we have satisfaction around that. We have the amount of time that we actually spend with a family talking about a problem turns out increases with both a virtual visit and with the hybrid visit in comparison to the in-person visit. So there's so much time that's taken up by all the stuff that we do in person. And I think at the end, it leads to just less time with the provider. And so that's another value add, I guess. But those are the things that we're doing in urology to sort of monitor how we're doing and how virtual visits are effective.
That's great. That's wonderful. I want to be able to answer people's questions, but before we do, I guess, what do you guys think is the future of virtual visits? I personally think they're here to stay, but how do you think they're going to be used? What are your thoughts? Michelle, do you want to kick us off right from your perspective?
I think that I agree that they're here to stay. I think that, it's nice that they aren't every single visit that the way they were during portions of the pandemic. I think it's really important that as pediatricians, we kind of guide that experience for our patients because I think it sets the stage nicely for them when we say to our families that you could be offered a virtual visit. I think that shows confidence in virtual visits for our families and helps them understand that that's not a surprise, that that's something that we have confidence in, and sets the stage for a really positive experience with a potential virtual visit, and shows that we know that these are safe, important, and high quality care contacts with Boston Children's. Most of the families that I see, if it's something that I have seen virtual visits occur for previously at Boston Children's, I'll say, they might actually say you could have a virtual visit for this. If it's something that I think could be a virtual visit, I'll say, this might be something they offer you a virtual visit for. I don't know if they will, but I think that could be done pretty safely. What do you think about that? And if I get a positive response back from the family, I'll actually put in the referral saying, family would like this to be a virtual visit, so that is shaped and guided right from the start as something that family is open to. And when that comes right from the start from your pediatrician, I think that makes it something that is not only positive, but something that the family knows is an expectation, and something that is, I guess, endorsed maybe is a word that I could use. And I think that sets the stage for a good experience. I think that's really important because we all do work together as a team, and they want to know that their pediatrician is on board with that. So I think it is something that's here to stay, and I think it's our job to help families understand that's a good thing. That helps people get care when they need it in a way that's appropriate and positive.
Well, that's beautifully said. Carlos and Sarah, what do you think?
Yeah, I agree, here to stay. And I think, it's going to be a matter of hitting the right balance. What is the right mix? And I think with always a deference to, patient and family preferences. I think there are certain patients now, and I think forever, would just prefer to be seen in person, even if their visits are amenable to virtual. And that's perfectly fine and reasonable. I think we need to account for that and be sensitive to that. But I think they're here to stay. I'm very optimistic about technological improvements for remote monitoring of all kinds of different things, enabling, and I know Sara from cardiology can speak a lot more about this. In urology, we have little reason to have technology enhanced examinations, but I think there are exciting things in the works. And the last thing I'll say is I think there is still some work to do, though, in which a lot of groups at Children's and other places are doing, around things like website manner. How do we conduct a virtual visit? What are best practices? How do we really connect with patients and families? I think we can say anecdotally, we think we do, as I said earlier, but let's study it and let's determine if there's a best way to do it or a better way to do it. So I think that needs to be done and is on the horizon. And so here to stay, but I think really a lot of reason for optimism.
Sarah, anything you'd add?
Yeah, I think we could now there's been some questions or topics in the chat about training. And I think in the beginning, Mary Mullen did a spectacular job with some medical students who were trying to learn clinical medicine in, May of 2020. Must have been so disheartening for that group, but she was able to have a really great experience where she could, be literally in the same room, but allow them to lead the conversation. And I think there's much more to be done with education, also with kind of expectations and rigor around a virtual visit. A lot of what we do is question and answer and talking, but asking the family to do a height and a weight before they get on the visit. I've seen people do, walk tests where people walk around with a saturation monitor on. Now everyone has them, and for cardiology, that's important. So there are some really creative things that we can do with them. I would say we are about 10 to 20% virtual, depending on the area and the and kind of the percent positive of COVID, and having this capacity to kind of easily flex between the two has been super important. So we'll definitely be using them, and I think we'll be pushing some aspects as we go forward, including even maybe we've got some cardiac fitness stuff going on, some really creative ideas around engaging people in things that weren't no one would come to Boston Children's Longwood to do, and now people are really excited about. So
that's great. That's great. Okay, so now we want to turn it over to you all. If you have questions, please put them in either the chat or the Q&A. We've tried to address some of them along the way, but I think we've had a couple comments about education and about trainees. I'd say I think you gave the best case scenario, Sarah. There's another comment here acknowledging that sometimes it might feel, because you're going directly from the trainee to having the attending come in, that the attending's not getting the full picture. I'm not sure what you guys think about in that regard. How do you integrate trainees into virtual visits? Maybe that would be helpful for people to hear.
I mean, I can say a few words about that first. If the trainee is sort of pretty confident in what they're doing and farther along, I love to have them kind of tell the story back to the family and have the family chime in and say, oh yeah, and a little bit more interaction, and it gives a chance for the family to hear what we are understanding, and then have and me to hear how the trainee is conceptualizing it. So I think that is something that, usually we're standing outside the door and hearing this and hearing the story, and then popping in briefly to talk about the plan. And it can be really a good opportunity for the trainee to reverbalize the story and the situation. Other ways we've done it is to have the attending, with the video off, but listening. Some people really like that. Other people find it like, oh, you're lurking there. It's a little creepy, but that's another way to make sure that all the questions are being answered and you're present for the entire time, especially in an early person. Generally, I like to just, if somebody's just starting out, I'm there right from the beginning, and I hear what they have to say and how they're asking the questions to the family and what the family is responding to.
I actually would argue that from a patient-centered perspective, the approach of having the trainee feedback what they hear is actually super important, because then you really walk away with a shared mental model of what's going on, what the concerns are, in a way that I think by popping out and having the conversation might not always achieve as well in that context.
Yeah.
Carlos, anything you'd add in that context about trainees?
Yeah, we've done it. We've tried to recreate what we do in person, and that is the trainee starts the encounter, gathers the history, and then the attending joins, and then goes over everything and really makes sure that everybody's on the same page. The one thing I would say is maybe not consistent, at least in urology, is giving a patient and family a heads up that this is going to happen. Like we can do in person. When they show up to the front desk in urology and Honeywell, we say, hey, listen, you're going to see a trainee first, but Dr. Estrada will be in. That is not as easy to do because we don't have a ready front desk virtually. And so maybe, we can think of ways in which we can be more communicative about what to expect ahead of time in terms of trainees. And so that would be my only addition. And I think maybe some work to do there.
Yeah. That's great. We should try to feed that back to our virtual visit team. So there probably are some ways, but this is just another example where I would say, there are some best practices that we should be spreading and making sure that people are doing them more consistently, because I think there certainly are better and more space. There's a real quick question here. If patients, if they're not available to connect by a video call, can you still bill for a virtual visit? What do you guys do in that setting?
Sorry if I could answer this one, at least my understanding of this is during the emergency situation, we were permitted to do so as long as you documented clearly that this was done via telephonic. I'm not sure what's going to happen once this expires. Whether if the video doesn't work, can you still bill for a telephonic encounter? I think it's TBD as far as I understand it.
Mm-hmm. I think that's right. And I think likely it'll probably change, but I don't think we know yet. I don't think we know. So it looks like waivers have extended into other areas, even into the Midwest. And I would agree. I do think that this is an important point. in terms of the access is that, for people who are in more underserved areas, and you might say we have fewer, but actually there really are areas for which people are having to drive quite a distance to get to us. Having the opportunity to have a virtual visit, at least some of the time, I think has been a game changer from that perspective. So I do think that's a really important point. And then we have another example of how people are teaching in the context of telehealth. And I think that too is, I think there's a lot of learning that we can do and sharing learning around how we do that. Does anybody else have any other questions that you'd like answered, or about how we do virtual visits here at Boston Children's, about just things more generally? Obviously, I think that we have just a huge opportunity. And certainly one of the things that I really want to make sure is clear is that I'd say, while we have Sara and Carlos here representing cardiology and urology, this conversation would be similar with all of our subspecialties and our primary care. As Michelle has said, actually, we should talk, Michelle, about your own virtual visit sort of that you're doing in a second. But just to say, I think everybody's really working hard to understand how do we integrate virtual visits in and make it really valuable to our patients and families over the, once again, the longitudinal sort of relationship that we often have with most of our patients. Michelle, do you have anything to add from a primary care perspective in terms of how you're using virtual visits yourself?
I think there are some great primary care uses. I think that it was something that we were looking as a use case to roll out in 2020 in my network and specifically in my practice. And I think we were trying to be very judicious and careful about how we used virtual visits. And then the pandemic hit and we're like, okay, got to use everything. But the great thing is that there were so many specialty societies that had really clear use cases already. And so we were able to kind of utilize some of their policy statements. We knew that we had great test use cases for dermatology. We had great test use cases for some behavioral health issues. And those are all applicable to primary care pediatrics as well. So whereas early in the pandemic, I know that a lot of folks were trying to do well visits by telehealth. I think that there's a lot of pediatricians who never want to see that part of their healthcare ever come back. And myself included, there's just some things that are not, telehealth friendly. Behavioral health is beautiful on telehealth. Just as we were saying, you have a teenager who is surrounded by their things at home. They're much more emotionally open to discuss what's going on in their life. So I think that that's going to be something that's here to stay. Our nutrition visits are great in that aspect. You can do a beautiful asthma follow-up visit with their meds at home. You can do a fantastic ADHD follow-up visit for meds at home. These are much more accessible for patients. They're much more likely to, keep that appointment. And it's much more time-friendly for families. So you can do those really, really well. And those are a much better and more accessible thing for our families. So we've really liked continuing to use those. We're continuing to look at some other test use cases. Having a flat picture of a rash is not always as great as having a dynamic picture of a rash. So sometimes we pair those up. We ask for a static picture and then we do a video visit so we can see things in movement with better lighting. Those are better ways to kind of pair that up, but still do a virtual visit as well. So we're continuing to test these things, and we always tell our patients up front, there's a chance that we see this and we're going to ask you to come in. We're not doing that to be, to cause difficulties for your family, but sometimes during the course of a video visit, we find it's really better to have you come in. When you're upfront and open and honest with families, you can't go wrong. So we only have to use that very rarely. So I think there's a lot of use for teletriage in general pediatrics as well. It's something that we're just sort of piloting here in my practice a little bit. But families really like that. If you can see and hear a patient, you're like, oh yeah, no, you're breathing, you need to come in. So it's very, very useful. It's not something that really has a robust payment model, but it's very, very useful. Things don't have to necessarily have a payment model to be helpful.
No, I agree. I think there's so much value in other ways, that we can't always just look and see what the bottom line is from that perspective. Thank you so much. Sarah, can I just address this one comment that's in the Q&A, because I think it's super important. So somebody asked about patients who don't have internet access and how can they access virtual visits. And this is a great opportunity for me to talk to you all about the fact that we actually screen every patient. Both we're trying to get at what Carlos had said about preferences. What are patients' preferences more generally around virtual and in-person? But in addition to that, screening if there are any barriers. And we actually have a program to provide hotspots and different ways for which people can access virtual visits if they don't have access. So just want to really make that clear. Children's is going out of their way to make sure we can reach everyone. And so please spread the word. We're really trying hard actually to give more of them away. Sarah, I didn't mean to stop you from jumping in.
Oh, no, that's really great. I was actually going to ask Michelle and also Carlos, have you explored kind of nurse virtual visits? We're just starting to think about that in terms of education and transition for our congenital heart disease patients as they go from pediatric to adult providers. It's sort of a education like after, separate from the visit, but just curious about that.
Yes, Sarah, extensively, in fact. So pre-pandemic, one of the studies, in fact, was a scheduled nurse post-op visit, which happens early in the post-op care course. And we were asking the question, does that virtual visit by a nurse impact ED visits, extra phone calls by concerned families, et cetera? So do we head things off? And so we've done virtual visits, and we continue to do them with our nurses as well as our APCs. And so extensively. And I think it's the same benefits that we enjoy. Our nursing colleagues and APC colleagues have the same. So yes.
We actually think some of our post-hospital discharge visits could be better done by video. It's really different when someone can show you their medications as opposed to trying to tell you a medication name that they can't pronounce. And let's be honest, sometimes we can't pronounce either. So being able to do that kind of give and take by video probably would serve the patient a lot better.
Yeah. If I can make one comment about Sara Toomey's comment about the hotspots and providing access. I think this is such a huge opportunity. And, I think virtual visits in a lot of ways, can be an equalizer. Patients for whom traveling to Children's Hospital is a burden, public transportation, whatever it is, and multiple jobs, et cetera, schedules that don't line up, the multitude of challenges that patients and families face. This makes it so much easier for them to access care. So I look at this as a huge opportunity to drive equity and equitable care. And I hope we can really go in that direction as strongly and as quickly as possible.
So I think we're coming close to the end of our time together. I guess I'll just go around and see if anybody has any last comments to make, just that they haven't had a chance to share, and then we'll sort of wrap up.
I guess I would just say that I think I've learned a ton from this sort of forced rapid transition to virtual visits. I think there are some really creative ways that we can move forward with this. I think we're better at it than we were at the beginning. And I'm looking forward to kind of doing a little bit more science around it and fine-tuning what we do and putting a little bit more rigor around how we do it as we go forward. But I think a lot of families have let me know they really appreciate it. And I think you're right about the access issues. And so I'm looking forward to hear more from you all about what you like and how it's working and how it goes forward.
We just got another case scenario. Somebody's writing in the chat around genetic counseling. And how important that, how great that is really. And newborn babies, it's so hard to get them anywhere, and when you can really just have a conversation and understand that in your own home setting, I can imagine it's really great. It's really great.
And prenatal screening and counseling, so very similarly. We've been able to reach a lot of patients and families there's no physical exam for sure. So it's all counseling.
No, that's great. Anything, Carlos, you'd like to add?
No, I just that, I guess to echo Sarah's comments that we've learned a ton. I think we have a ways to go. I think it is here to stay, but I think we should all be very optimistic about the opportunities that lie ahead to make access more plentiful, more convenient, and more equitable.
Michelle, what about for you? Any last thoughts?
Yeah, I think this is a great opportunity for us to continue to collaborate as colleagues across our enterprise, and that can only make care better. I think that nobody at our level of training or in our respective age groups really thought that this was how they were going to practice medicine. I think you can choose to be excited about that, or you can choose to feel otherwise about that. I'm looking forward to this being an area where people do get training on how to be a better doctor through this type of a platform. That's something that makes me excited. I would like to know how to do that better because I'm always excited to learn new ways of practicing in this field. So I look forward to collaborating with my colleagues and continuing to learn.
Excellent. No, that's wonderful. I agree. I never anticipated when I was in medical school this would be the way we're doing things. It's so true. It's so true. We're even using them in actually an inpatient setting, some are in the context of connecting with families more, and actually with other sort of primary care docs at times and things like that, which is really great too. So I think I am going to wrap up. I just want to just end by just once thanking all of our panelists who were just absolutely amazing as always, and just really grateful that you've taken the time to talk about your experiences. And I'm just hoping that all of you who are listening in have gotten a sense is that, we really are, as Carlos said, optimistic about the future of virtual visits, but we do have things to learn, and we're always interested in hearing feedback. So please don't hesitate to send feedback and let us know. Let us know when we doing great. We love to hear that, but also when we have areas to improve upon. And I hope that the message has also been clear that we really are trying to meet the needs of our patients and families, and do really take into consideration their preferences, recognizing that that is the most patient-centered approach to the care that we're providing. So thank you all for joining us. Once again, don't hesitate to reach out. Take care.